Which of the following best describes the primary mechanism of action of a left ventricular assist device, LVAD? A. It helps the heart to pump blood more efficiently by assisting the right ventricle. B. It reduces the amount of blood the heart pumps to the lungs. C. It reduces the workload on the left ventricle by assisting in blood circulation. D. It provides mechanical oxygenation of the blood. Answer: C. It reduces the workload on the left ventricle by assisting in blood circulation. Explanation: the LVAD assists the left ventricle by helping pump blood to the body, thus reducing the workload on the left side of the heart. This support is particularly crucial in patients with left-sided heart failure. LVADs do not oxygenate blood, which is the role of ECMO, and they do not affect the right ventricle or the lungs directly. In patients with a left ventricular assist device, LVAD, which of the following is the most important aspect of nursing care? A. Monitoring for signs of hemolysis. B. Assessing for signs of gastrointestinal bleeding. C. Managing anticoagulation therapy. D. Monitoring for signs of pulmonary edema. Answer: C. Managing anticoagulation therapy. Explanation: patients with LVADs are at risk of thromboembolic events, and anticoagulation therapy is crucial for preventing clot formation in the device and in the circulatory system. The management of anticoagulation therapy is the most important aspect of care to reduce the risk of stroke or device malfunction due to clots. Although monitoring for hemolysis, gastrointestinal bleeding, and pulmonary edema are also important, anticoagulation management takes precedence. Which of the following complications is most common with the use of ECMO in pediatric patients? A. Limb ischemia due to cannula placement. B. Liver dysfunction. C. Hemorrhage. D. Thrombocytopenia. Answer: A. Limb ischemia due to cannula placement. Explanation: in pediatric ECMO patients, the most common complication is limb ischemia, which occurs due to the placement of cannulas in major arteries. This can restrict blood flow to the limbs and lead to ischemic injury. While hemorrhage, liver dysfunction, and thrombocytopenia can also occur, limb ischemia is particularly concerning in small pediatric patients who may have smaller arteries and less collateral circulation. Which of the following is a contraindication for the use of an intra-aortic balloon pump, IABP? A. Severe peripheral artery disease. B. Acute myocardial infarction. C. Cardiogenic shock. D. Chronic heart failure with low ejection fraction. Answer: A. Severe peripheral artery disease. Explanation: severe peripheral artery disease, PAD, is a contraindication for IABP use because the placement of the balloon catheter in the aorta may further compromise blood flow to the lower extremities. In PAD, blood flow is already reduced in the peripheral vasculature, and the use of an IABP could worsen ischemia in these areas. IABP is typically used in conditions like acute myocardial infarction and cardiogenic shock. What is the key benefit of using a centrifugal pump in mechanical circulatory support devices compared to a positive displacement pump? A. It provides pulsatile flow. B. It is more reliable and has fewer moving parts. C. It requires less anticoagulation therapy. D. It is capable of providing higher flow rates. Answer: B. It is more reliable and has fewer moving parts. Explanation: centrifugal pumps have fewer moving parts than positive displacement pumps, making them more reliable and less prone to mechanical failure. This also simplifies maintenance and reduces the chances of device malfunction. They provide continuous flow, which is suitable for long-term support in patients with chronic heart failure. Which of the following factors is most critical to consider when managing anticoagulation therapy in patients on ECMO? A. Patient's age and sex. B. Type of ECMO system used. C. Hemodynamic stability and risk of bleeding. D. Duration of ECMO therapy. Answer: C. Hemodynamic stability and risk of bleeding. Explanation: the most critical factor in managing anticoagulation therapy in ECMO patients is maintaining a balance between preventing thromboembolic events and avoiding excessive bleeding. Close monitoring of the patient's hemodynamic status and the risks associated with anticoagulation is essential. Over-anticoagulation can lead to bleeding complications, while under anticoagulation can lead to clot formation in the ECMO circuit. What is the primary goal of mechanical circulatory support in patients with acute myocardial infarction, MI? A. To replace the function of the heart entirely. B. To assist the heart in pumping blood and improving tissue perfusion. C. To reduce the need for heart transplant. D. To control the myocardial oxygen demand. Answer: B. To assist the heart in pumping blood and improving tissue perfusion. Explanation: the primary goal of mechanical circulatory support in patients with acute MI is to assist the heart in pumping blood and improving tissue perfusion, especially in cases of cardiogenic shock. This helps stabilize the patient while the heart recovers. Mechanical circulatory support devices, such as the intra-aortic balloon pump, IABP, do not replace the heart but assist it until the underlying issue resolves or further interventions, like surgery, can be performed. Which of the following is a major advantage of using a centrifugal pump in a left ventricular assist device, LVAD, over a pulsatile pump? A. Pulsatile flow improves coronary perfusion. B. Centrifugal pumps have a lower risk of infection. C. Centrifugal pumps are smaller and less complex. D. Centrifugal pumps provide better long-term support. Answer: C. Centrifugal pumps are smaller and less complex. Explanation: centrifugal pumps are smaller and have fewer moving parts compared to pulsatile pumps, which makes them less complex and more reliable for long-term use. This simplicity reduces the risk of mechanical failure and is one reason why centrifugal pumps are increasingly used in LVADs for long-term heart failure management. Pulsatile pumps, while beneficial for short-term use, are more complex and require more maintenance. Which of the following is the most common complication associated with prolonged use of a total artificial heart, TAH? A. Pump thrombosis. B. Device infection. C. Acute renal failure. D. Hemodynamic instability. Answer: B. Device infection. Explanation: one of the most common complications of prolonged use of a TAH is infection, particularly related to the implantation site or the external components of the device. Infections can lead to sepsis or device malfunction and are a significant cause of morbidity and mortality in patients with long-term mechanical circulatory support. Pump thrombosis and hemodynamic instability are also concerns, but infections remain a leading issue. What is the most significant risk of using a mechanical circulatory support device like a VAD in a patient with acute heart failure? A. Inability to support the heart for long durations. B. Increased risk of arrhythmias. C. Development of systemic embolism or stroke. D. Excessive blood pressure lowering. Answer: C. Development of systemic embolism or stroke. Explanation: one of the most significant risks of using a mechanical circulatory support device like a VAD is the development of systemic embolism, which can lead to a stroke. The use of such devices, especially if anticoagulation therapy is not perfectly managed, increases the risk of thromboembolic events due to the formation of clots within the device or the circulatory system.